The first doses went out at one of the few hospitals still running in Gaza, marking the start of one of the most challenging immunization campaigns on Earth. As soon as we heard about the vaccine, we came, says this father. Airstrikes are everywhere, but I needed to protect my son against polio. This month, an 11-month-old boy contracted the first known case in the territory in 25 years. I'm afraid, says this mother. The disease paralyzes children for life. The reemergence of the virus is adding a new layer of desperation after 11 months of heavy Israeli bombardment.
It's a direct result of the conflict, the fact that the health system has been essentially decimated, the fact that water and sanitation infrastructure have been destroyed, people are malnourished, they're displaced, they're living amid garbage and lakes of sewage.
Israel and Hamas agreed to allow aid workers to deliver vaccines for around 8 hours a day in specific areas over the next 72 hours.
Not doing anything would be really bad. We have to stop this transmission in Gaza, and we have to avoid the transmission outside Gaza.
Gaza is in ruins. Hundreds of thousands of people are displaced. The vaccines need to be refrigerated in a place with no electricity, just generators. But the biggest challenge may be safety. Relief workers have come under fire during the conflict. Just this week, a U.S. aid group says its convoy was hit in a deadly airstrike, while the World Food Program paused the movement of its staff after a vehicle was shot.
It's a very complicated effort. We're not sure that there have been any efforts on this scale anywhere in the world in recent time.
Aid workers need to reach 90% of children in Gaza under 10 to stop transmission and prevent a wider public health crisis. Taria Isri, Global News, Montreal.